Assalamualaikum. My name is Ahmad Shazwan bin Ahmad Baizawi, and today I'm going to present my group's topic of human nutrition in life cycle, which is pregnancy and lactation. Moving on, we will move to energy expenditure during pregnancy. Caloric intake should increase by approximately 300 kilocalorie per day during pregnancy. This value is derived from an estimate of 80,000 kilocalorie needed to support a full-term pregnancy and accounts not only for increased maternal and fetal metabolism, but for fetal and placental growth. Dividing the gross energy cost by the mean pregnancy duration, 250 days after the first month, yields the 300 kilocalorie per day estimate for the entire pregnancy. However, energy requirements are generally the same as non-pregnant women in the first trimester and then increase in the second trimester, estimated at 340 kilocalories and 452 kilocalories per day in the second and third trimesters respectively. Furthermore, energy requirements vary significantly depending on a woman's age, body mass index, and activity level. Caloric intake should therefore be individualized based on these factors. Next, we will look at the nutrients needed for pregnant women. The nutrients needed for pregnant women are divided by two, which is macronutrients and micronutrients. For macronutrients, recommended protein intake during pregnancy is 60 grams per day, which represents an increase from 46 grams per day in non-pregnant states. In other words, this increase reflects a change to 1.1 gram of protein per day during pregnancy from 0.8 gram per day for non-pregnant states. Carbohydrates should comprise of 45 to 64% of daily calories, and this includes approximately 6 to 9 servings of whole grain daily. Total fat intake should comprise of 20 to 35% of daily calories, similar to non-pregnant women. For micronutrient, the recommendation for daily micronutrient intake for a pregnant woman are determined by the Recommended Dietary Allowance or RDA data. In general, these RDA refer to the levels of intake of essential nutrients that are judged by the Food and Nutrition Board of the Institute of Medicine, IOM, to be adequate to meet the known nutrient needs of practically all healthy persons. The RDA have been modified for pregnant women. For example, a pregnant woman needs 1,200 milligrams of calcium per day, 600 to 800 micrograms of folate per day, and 27 milligrams of iron per day.
Assalamualaikum warahmatullahi wabarakatuh. I am Habarim bin Muhammad Azhari. I will continue my group presentation in a subtopic pregnancy after bariatric surgery. Pregnancy after bariatric surgery is not uncommon as a fatality often improves after a bariatric surgery procedure. Given that, bariatric procedure can create deficiencies of micro and micronutrients. A pregnancy occurring after a bariatric surgery procedure requires particular attention to nutritional status. As stated previously, requirement for calorie, vitamin, and mineral increase during a pregnancy, so nutritional deficiencies in the bariatric surgery patient can be exacerbated during pregnancy. The most common deficiencies that occur after bariatric surgery are vitamin B12, folate, and iron because malabsorptive procedure, example Roux-en-Y gastric bypass, biliopancreatic diversion, have a highest risk for nutritional deficiencies. Closer surveillance in pregnancies that occur after this type of surgery is appropriate. For the eating disorder for women with either a history of a current eating disorder, example, anorexia nervosa and bulimia. Additional questions regarding their weight should be asked, including how they feel about weight gain, being weighed, and at a very prenatal visit, which is customary in prenatal care practice in the United States, and the ongoing change in their body. Counseling on gestational weight gain goal is still important for these women as weight influence and growth and development of the fetus. Similar to management prior to pregnancy, a, calibr- a, calibr- a collaborative team of experts in eating disorders should continue to manage and treat these women during the pregnancy.
Next, I will continue with my slide, which is lactation slide. Women who breastfeed require approximately 500 additional kcal per day beyond what is recommended for non-pregnant women. The estimate is derived from the mean volume of breast milk produced per day, means 7x0 milliliter, range 415 until 1200 milliliter, and the energy content of milk 67 kcal, which is 100 ml. During pregnancy, most women store an extra 2 to 5 kg in tissue, mainly as fat in physiologic preparation for lactation. If women do not consume the extra calories, the body store and are used to maintain lactation. It is not unusual for lactating women to lose over 0.5 until 1.0 kg month after the first postpartum months. During lactation does not usually impact the quantity or quality of breast milk, but maternal deficiencies in magnesium, vitamin B, folate, calcium, and zinc have been described during lactation. Both fat, vitamin A, D, K, and water-soluble vitamin C, B1 and B6, B12, and folate are secreted into breast milk, and their level are reduced in breast milk when there is a maternal vitamin deficiency. Vegetarian for lactation. Recommended dietary guideline for vegetarian during lactating are lacking vitamin D. Supplement are recommended for women who do not drink milk or other food fortified with vitamin D. A vitamin B12 supplement over 2.6 UG is also recommended for women who consume ovo-lacto vegetarian and vegan diet. Another recommendation is to consume 1,200 over 1,500 mg per day of calcium because of the possible decreased intake and absorption from a plant-based diet. The FDA recommends similar precaution regarding avoiding higher mercury fish during lactation. Observed neonatal effect have not been demonstrated with ordinary maternal fish consumption during breastfeeding.